Welcome to Seniors Today, a monthly program that is a voice for those 50 plus in Montgomery County, produced by the Commission on Aging, of which I am a community member. While the show is insightful for people of all ages, each episode takes a fresh look at issues by spotlighting seniors in the community, representatives of senior services and programs, and activities of interest to seniors. My name is Katie Smith, and today our discussion will focus on serving diverse communities. We will learn about county programs that meet the needs and expectations of increasingly culturally and ethically varied populations. Joining me is Arlee Wallace. Arlee is the program manager of the Montgomery County Department of Health and Human Services African American Health Program, or AAHP. How are you, Arlee?
I'm doing well, and thank you for having me today.
I am so glad to talk to you. Arlee, tell us about the mission and structure of the African American Health Program.
Thank you. Yeah, the mission of the African American Health Program is dedicated to provide services to the diverse Black community that focus on reducing and eliminating health disparities so that the Black community can live a longer and more equitable life in the county. We are actually structured in three different folds. One consists of county staffing that deals with the oversight of the African American Health Program. And then we have a vendor that implements our services, and that vendor is selected through a solicitation. And then we have an external non-appointed advisory committee that assists and advocate for the funding for our services on an annual basis.
Well, with the way all those components work together, can you share with us some of the specific ways that you all empower African American seniors to improve their health outcomes and promote wellness?
Yes, one of the key things that we did within the African American Health Program was to actually establish an aging subcommittee. That aging subcommittee primary goal is really to help educate, influence, and connect seniors to services. So the different components actually work together to make that possible. And in doing so, we then provide services that some of the seniors may not be aware of, may not be eligible for, and then we are there to work to connect them to services in any type of venue in which we can, so that it can help them meet their needs. And that could include anything from being able to work with utility assistant, rental assistant, pharmacy, helping to connect seniors as well to senior fitness centers that they are interested in. And we've been able to also connect to various resources, especially in light of COVID-19 when it came to transportation, and just connected them to the vaccine as well as COVID testing opportunities.
Interesting. You mentioned meeting the needs of the community, and you guys do a remarkable job at that. It's very interesting. I know you recently hosted the Black Health Wellness Week and the virtual AAHP Community Day 2021. Can you tell us about that event and maybe some of those featured sessions?
Oh, yes. That was our 8th annual event. Those sessions included everything from kicking off with a walk that was with our partner organization, Girl Trek. Then we started the morning out just getting some basic acknowledgement from some of the community leaders in the county. From there, we actually moved on and we had very good conversations from individuals that work on different programs. So we heard from people who talked about SMILE, which I'll start more infant living equally healthy. We also was able to provide services that is more correlated with the senior project that dealt with like a healthy cooking demonstration that was performed by one of our consultants. And then we actually concluded today where we was talking about prostate cancer that impact Black males, as well as mammogram that influence and have an impact negatively in the Black female population. And we closed out our day with a panel discussion with individuals that were speaking from the subjects of mental health, chronic disease. We had an infection specialist person available. We had a mammogram specialist doctor who was there to deal with the women need. And then we had dentists as well, because a lot of the time people fail to realize the importance of our oral dental health. So we provided information to the community at large about those services and what AAHP has to offer them.
That's a very comprehensive event that you hosted. And I know you do, again, conduct, routine events in the county and you have your meetings. You mentioned the Subcommittee on Aging. Now, is that open to the public and where can people go to learn more information about your upcoming events?
Yes, the subcommittee is definitely open to the public. We host our meetings the first Tuesday at every month from 4:30 to 6:30 p.m. Anyone who's interested in being a part of the meeting, they can always contact me or look on our website as well to get that information. It is publicly there on our calendar.
Okay. Well, Arlee, we have a little bit of time left, and I want to move on to a different aspect of diversity since that's the focus of our conversation today. Serving diverse populations is not a one size fits all process or approach. It includes all differences for those that identify within the same population, and this is especially true for senior populations. So, how does your program encourage the capacity to serve older adults with different experiences and resources? And part two, how can someone looking for creative ways to reach the community participate?
Well, our program has indeed looked at the different diverse Black populations because a lot of the county services is based on one's income. And there are some policies in place that a lot of individuals would not be necessarily eligible. Therefore, we seek to go out to various partners and do partnership. One of the primary things that I was looking at when I first started was working with Washington Gas, along with HHS, Department of Aging and Disability, where we pulled together a winter revitalization program that addressed seniors and making sure that we could have their home winterized. That includes addressing their windows, replacing windows at sometimes, dealing with the aerator for water control, also replacing filters in their home. That was an annual event that we were typically involved with, and we'll continue to resume once they allow us to now re-enter the homes of our seniors. On top of that, we've also gone and created and worked with the emergency rescue of Montgomery County to address fall prevention in the homes of seniors. We were fortunate prior to COVID, once again, to be able to have 46 homes that we were able to go in, do observations for anything that could influence and make them fall, in checking their fire alarm, as well as making sure that they had carbon monoxide also in their the plug-ins at their home to detect that. And then to do a basic health screening of the seniors. We did blood pressure, body mass index. We were able to weigh those who was willing to get on the scale. And then we had nurses and others that was there to make sure that they understood the proper techniques in taking their blood pressures in their home alone and understanding that. And then, my goodness, we also were able to put on a senior summit about 2 years ago, just for seniors, so that the seniors in Montgomery County that was primarily Black could understand the vast number of services in which the county offered.
Wow. Arlee, I will say that, the work that you do in diversity and specifically with the African American community, it's definitely, resourceful and people have so many ways to connect with you. Really quick, how can somebody follow up with you if they have any questions about something that we discussed? Can they email you? And if so, can you share that email address?
Yes, my email address is Arlee, that is ARLEE.Wallace, WALLACE @MontgomeryCountyMD.gov. And you can also reach me by calling my direct line, if you like, which is 240-777-1451. And the main office number is 240-777-1833.
Arlee, I enjoyed talking with you. Let's be sure to stay connected.
Thank you. And once again,
Absolutely.
Thank you for having me.
You got it. Up next, we will talk with Gianina Hasbun, who serves as the program specialist for the Latino Health Initiative.
You are loved. You are valued. You are resilient. You got this.
You're there for them. We're here for you. Find free care guides at aarp.org/caregiving.
places.
The Latino Health Initiative prioritizes the development and implementation of integrated, coordinated, culturally, and linguistically competent health wellness systems that supports, values, and respects Latino families and communities. Joining me to talk more about the Latino Health Initiative is Gianina Hasbun. Welcome, Gianina.
Thank you for having me, Katie. It's
I'm
always a
so glad
pleasure.
to talk to you. Gianina, what types of services does the Latino Health Initiative provide to seniors in our community?
Yes, again, thank you for the invitation. The Latino Health Initiative has a number of programs, health promotion programs that are geared towards the Latino community, but of course, having our older adults in mind as well. For example, we have our healthy eating sessions. This is a 4-session program that teaches about the importance of healthy eating. It teaches about the My Plate guidelines, how to eat healthy on a budget, how to read labels. And of course, in all of our programs, we provide resources to families and participants. So that's one of the programs. We also have another one that we call Caminatas. It's a walking program that's on hold for now because of obvious reasons, the pandemic. But it's a 6-session program and it's geared to families in general, but we have a significant amount of older adults also that participate in these sessions. So they benefit not only from the physical activity itself, but also socializing, building community. And it's a very simple program. Participants gather at a place that's convenient to them in their neighborhoods, like a church, a school, and they learn very basic stretching and warm-up exercises and walk at a pace that's comfortable for everyone. We have health promoters that go along with them and make sure they feel safe and comfortable. And of course, as I mentioned before, they learn about the importance of physical activity and resources. We also, another significant thing that we do is connecting people to services. So our health promoters, along with an information line that we have, will connect people to services. There are many services out there that our community sometimes are unaware. So that's something that we have been doing as well. Be it food, transportation services, health services, of course. And also we have been partnering with other organizations such as the National Hispanic Council on Aging, and we have been providing training to our health promoters so they become leaders in issues that relate to our senior population, conducting community forums as well to raise awareness about older adults, specifically the Latino older adult issue.
So you mentioned, Caminatas, the walking program, and I know that's on hold right now because of COVID-19, the ongoing pandemic. And you also mentioned connecting, Latinos in the community to services. So with the Latino community, we know they've been very hard hit by COVID-19. Can you tell us a little bit about your specific program, Por Nuestra Salud y Bienestar?
Yes, definitely, Katie. The Latino population was very hardly hit, and we were affected in a very disproportionate way with COVID, and that's the reason why Council Member Navarro and Council Member Albornoz proposed that it would be great to have a program that targets the Latino population, and that's how this started. And it's coordinated, let's say, through the Latino Health Initiative, but it's a partnership between 8 other organizations. We have community clinics, community-based clinics, And it's a very comprehensive program. It was created in a matter of a few days, but it is a very comprehensive program. So it includes the testing component, which was a very big part of it. Now, the vaccination piece is a big part of it. It has an information line, a helpline where people call and find out where vaccinations events are taking place, where the COVID testing is happening. And what we're trying to do with the program is breaking down all the barriers that Latino may face to receive services, and has other components as well. It has an educational outreach piece. So again, the health promoters, they're out throughout Montgomery County providing information about where to get tested, where the vaccination events are happening, prevention measures. It has a big communication piece to it as well. So we're using traditional media like radio, TV. We have a wonderful character. Her name is Abuelina. She's a grandmother who is from El Salvador, but she provides information about services and other educational pieces about the importance of the vaccine, for example, and preventive measures. There's a case management component to it as well, so helping people to navigate all the different services that are available right now for COVID, for any other social services.
That sounds like a lot, Gianina. I only have a little bit of time left with you. I want to say briefly, in the last segment, we spoke with Miss Arlee Wallace from the African American Health Program, and they do a lot of similar work to the Latino Health Initiative. And we know that, serving diverse communities, it thrives best when there are partners and stakeholders, and when those partners and stakeholders are inclusive and sensitive to the needs of the community it serves. What are the ways that the Latino Health Initiative establishes a visible presence in our neighborhoods with the type of work that you do to build those trusted relationships?
Yes, definitely. The partnerships are key in all the work that we do. So we always try to collaborate and partner with organizations that are already out there in the community that the people already know. And we partner with very local organizations, and it could be senior centers. We've done work with senior living complexes. We've done work with the churches, and we always try to partner. As I mentioned before, we also do partnership with other organizations such as the National Hispanic Council on Aging, bringing information to the community. But also, I just want to highlight once again the work of the health promoters. That they are wonderful trust brokers in the community. They come from the community they serve. They know the needs of the community firsthand. And so people just immediately, break those barriers with them. They speak the language. They just feel so comfortable. So they do wonderful work providing information and making sure we have that trust in the community.
Well, I like that terminology, trust brokers. I think I'm going to use that myself. Gianina, how can we stay connected to the Latino Health Initiative?
Yes, one way is through our website, and that's lhinfo.org. Again, that's lhinfo.org, or you could call our main number, 240-777-3221.
I enjoyed talking to you. Thank you so much for joining us and sharing very valuable information. And we look forward to speaking with you again soon.
Thank you for your invitation. We really appreciate the opportunity to share information about the work we do.
You're welcome. It's excellent work.
Thank you.
Up next, we will talk with Betty Lam, Chief of Office of Community Affairs for the Montgomery County Department of Health and Human Services, about the Asian American Health Initiative.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
The Asian American Health Initiative works not only to improve the health and wellness of Asian American communities in Montgomery County, but they do it by applying equity, community engagement, and data-driven approaches. Here to tell us more is Betty Lamb. Hi, Betty, how are you?
Good. How are you, Katie?
I'm doing well. I'm so glad to talk to you today. You know, Betty, the Asian American Health Initiative has 4 core priority areas that assist in learning more about the needs of Asian Americans living in our community. Can you share what those are and explain how they help to improve the lives of older adults, their families, and caregivers?
Sure. We affectionately call the 4 core areas the 4 C's, and they are community engagement, community empowerment, capacity building, and change catalyst. So collectively, the 4 core areas lead us to working with individuals, families, community, and also at the system level. So what we really mean is that on a regular basis, we realize that we need to connect with individuals and families at different occasions, different forums, different venues. So we organize and participate in community events, do presentations, organize training, workshops, and just basically make ourselves available at different occasions to bring information around resources. But we also realize that our staff and our programs are not always available when individuals and families need them. So we also wanted to make sure that the trusted entities in the community are also one of our outreach targets, so that we work with those entities and help them and give them information around resources, so that when families have needs and they can't find us, they can always rely on the trusted entities to make that connection. So, and at the system level, just quickly, we also wanted to work with advocating around system change, so that when policies are being decided, funding are being negotiated, or practices are being modified, that the Asian American Pacific Islander communities' needs are also being considered, so that designs are, culturally competent and linguistically competent for the community.
You mentioned trusted folks in your answer. I have a question about Asian American Pacific Heritage Month. So it was just in May, we're coming off of the heels of that. How did you pay tribute to the generations of Asian Americans and Pacific Islanders who have enriched our local community and who are fundamental in our future success as a county?
Well, every year during the month of May, we organize special events and activities to celebrate. Well, this year is a little bit different. We can't do it in person. So what we have decided to do is to choose to do it virtually. So we combined the AAPI Heritage Month with Mental Health Awareness Month. So we celebrate and we acknowledge and honor the Heritage Month with a lot of interesting facts and information around the Asian American community, their contribution to the US history and the development of the country, and also mental health awareness. We combine the two and we share it on a weekly basis, interesting facts. It's meant to be lighthearted, but at the same time, educational.
Yeah, you're so right about that. Asian Americans have definitely done a lot to pave the way, not only in Montgomery County, but in our nation as a whole. And just understanding the types of services that diverse communities value and delivering those services to enhance trustworthiness. We talked about that within community. What does your work reveal about the needs of Asian American seniors in our community, especially in the current climate that we live in, which is so heightened?
Well, I have to say that for the current climate, especially around the point of current climate, I think one of the myths about Asian American is that we are a model minority. This suggests that the Asian American community are all successful, all well-educated, and all healthy, and that we have no needs, and that if we were to have any needs, that we could take care of them ourselves. And this kind of labeling of the community is really very harmful. And some of the harmful effect is that some in the Asian American community might have internalized that as a positive attribute, and that actually hinder their help-seeking behavior. They might think that, there are no help out there for the Asian American community. I should take care of it myself, even though something can be, very overwhelming for an individual or a family. And especially during this time with COVID, as we all know, there are a lot of economic fallout. But with the Asian American community in particular, there's a lot of stress and mental health issues around being stigmatized as associated with the origin of COVID-19. So that has increased the fearfulness, especially with our senior community, that because of the pandemic, they are already socially isolated. They can't see their family. But then now that the county is beginning to reopen, they are still fearful because of the anti-Asian sentiment. So I think what we need to do is to continuously give them tools, help them understand, help them know how to act when there are such incidents, what to do afterwards. So there are a lot of effort around that. And also the Asian American Health Initiative is very interested in working with the larger community in educating the general public around Asian American, its culture, its contribution, its long history with the United States, so that we are not viewed as foreigners or as contributing to the current crisis that we have.
Right. So we have only a little bit of time, but if you could briefly tell us this, you mentioned tools of understanding, tools of engagement. Tell us a little bit about your background and the equity tool that you developed for Montgomery County, briefly.
I am very happy to report that I am part of a greater effort within the Department of Health and Human Services in the equity work. We developed the equity principles, train and continuously hold forums within HHS to help our staff understand what equity means, what racial justice means, what biases means, so that that could guide our work. And I'm hopeful that the tool that we share with the community will be utilized as much as it is utilized within the department.
I'm sure it will be, Betty. We've discussed a number of different topics of importance to the Asian Americans and Pacific Islanders, but I want to thank you so much for this informative conversation. That concludes our program for today on serving diverse communities. As you can see, the voices of seniors matter every day and every way in the planning for diverse communities and those they serve. Thank you to everyone who was able to tune in. We look forward to talking to you again next month. For more information about senior services in Montgomery County, please visit the Montgomery County Seniors website at montgomerycountymd.gov/senior or call the Senior Resource Line at 240-777-3000.